Talk Erie and the Joel Natale Show. We're live from our Kingdom Financial Group studio here at 5th and State, also live on YouTube and on Facebook. And we're having the crucial conversations that Erie needs. And today we're talking about back to school immunizations, how important that they all are. And we're glad to welcome back to the show Erin Mrenak. She is the Director of Public Health for the Erie County Department of Health. Good to see you again, Erin.
Good to see you as well.
And we also have Dr. Timothy Pelkowski. He's the chairman of the Board of Health here in Erie County. Dr. Pelkowski, good to see you, sir. Appreciate it.
Thank you very much. Happy to be here.
We're a family show. We like to hear origin stories. Why don't you tell us how you came up?
I originally from this community in Erie, went to high school at Iroquois, did school out at Case Western, med school out there too, came back here for residency at St. Vincent's and have been at St. Vincent's ever since that time, so decades now.
So would we find you at one of the pavilions or something like that? Or where do you usually practice?
Involved with graduate medical education, so involved with the St. Vincent Family Medicine residency program in particular.
Okay, so you're at the hospital with the up-and-coming students.
Exactly.
We're still pretty attractive, right, for residencies?
Absolutely, and definitely there's a need for primary care, thank goodness.
Yeah, I had quite a few friends, who were my age that came in from out of town, and they chose Erie, for their residency.
Sure.
One of them became a missionary in the Congo.
Wow.
Went to Tulane for tropical medicine.
Huh.
And I don't know how his wife was from Perry, New York, so not that far away, about 100 miles away.
Yeah.
And somehow it worked that they went to it was before AHN, was St. Vincent's.
Yeah, exciting.
Isn't that something, though?
Yeah, absolutely.
And then he's in Congo, Or I think they might be stateside now. They're getting older. They're my age, right? But anyway, and we're all getting older. But back in the day, we had to take our shots. And,
yes.
And what's standard of care these days for babies and then for the preschool immunizations? What is it now? Because you hear these horror stories like, well, they want to give my kids 72 shots before 5 or whatever. What's reality?
So it's not 72 shots.
Okay.
There's a very well-researched and studied schedule for vaccination based on the most efficacy in getting an appropriate immune response for certain age groups. Feel free to jump in whenever you need to, Dr. Pelkowski. So everything studied thoroughly, and what they have done is made some combination shots. So it ends up being less shots for your child when you can get those medications in combination with the same efficacy for what it does to build your immune system.
Okay, so is it? I mean, I know there's a lot of shots right after the baby's born, right, in 6 months, and is it basically throughout, or do they take a break from 2 to 5, or
there are
what
some
are the
breaks.
ages?
There are some breaks that are built in there, and then you see another little spike between 4 and 6, and then the rest of them are more like booster doses from 12 to 18.
Gotcha.
So it's a schedule that goes from infancy till someone's 18.
All right, and what in general are we immunizing for? What's the stand again? What are the standards?
We are immunizing for a lot of things, and I actually brought my cheat sheet because Colleen's not here because I didn't want to miss anything. So we are, and do you want to take any of these? Feel free.
And maybe before I'll just mention, I know that there's this perception that there's a large number of vaccines, and for me the thing that I really resonates with me is I remember in training in residency on the pediatrics floor having to do large numbers of spinal taps to sort out what was going on with these infected children in particular.
So it didn't come up in a blood scan, huh?
Yeah, no. These would have to be done with the needle into the back. I think the highest I had done was 16 or 17 in a 24-hour period of call. And now on that PEDS floor, we just don't see these. And this is primarily because of the Hib vaccine, or Haemophilus in particular. So I felt like I saw it during my training, and now I don't see this at all. And it's directly because of that new vaccine that was really up and coming when I was a resident. And I can really say it's produced tangible results, less illness, less issues.
Which vaccine is this?
Haemophilus influenza. Hib is the acronym for it.
But it's an influenza vaccine.
It's not influenza. This is Despite the name, it's a bacteria, can be associated with a number of illnesses, and one of which can be meningitis. And now, certainly not seeing it to the volume that I saw when I was in training, 25 years ago.
So this has been like the big hedge against meningitis. I mean, a lot of kids used to get meningitis, right?
This is one aspect.
Yeah.
And of course, there are many other stories, related to these vaccines.
But have we seen meningitis kind of fall off a cliff? Or
Absolutely. I think we've seen decreases from that standpoint, especially compared to before that vaccine existed.
What other childhood diseases or diseases that children were apt to get regularly, let's say in the 80s or the 70s, that have kind of gone away? Because I'm trying to think. I probably had the measles. I know I had the mumps. I know I had chicken pox. Oh my gosh, I had chicken pox at 15. It was devastating. It was like 4 weeks out of school and stuff, right? But what were the things that we just kind of endured, but now that we do the immunization for?
Chickenpox would come to my mind as far as one of the more recent ones
Yeah.
in particular. And again, now very rare to see cases with us having that on the standard immunization schedule. So I've really seen dramatic improvement. Same even with pertussis. There was a thought that we were in fact seeing resurgences, and now making sure that we're recommending the pertussis that's along with tetanus to make sure that we're getting boosted.
Is that considered TB? Is that what you're talking about?
Not TB, pertussis.
Okay,
Very
pertussis.
separate respiratory infection, for lack of a better word.
And now that goes with the tetanus shot.
Exactly.
Okay. And they've been giving that out for quite a while, right?
Yes, no doubt.
Well, what was it? MMR?
Yes. Measles, mumps, and rubella.
Okay. And rubella's the red rash.
Yeah,
right?
and that's where the varicella, which is chickenpox, the vaccine is added to that. So it's a
they
combo.
added to that. Okay.
Yes.
And so they start giving that to the
It is available, yes.
to the babies. Okay. All right. All right. So let's go through the kind of the big ones, and then maybe some of the newer ones that people may not know about. Like I said, if I know MMR, mumps, and rubella, then most everybody does, because I'm so uninformed about all this stuff. But go through the list if you would.
So we vaccinate against hepatitis B. We talked about the DTaP, which is diphtheria, tetanus, and pertussis. We talked about Hib, which is Haemophilus, which is the one that Dr. Pelkowski just mentioned. And Haemophilus is one of the 74 reportable diseases that the health department tracks. So it is very unusual that we see a case of that because of vaccinations. Polio, it's a pneumococcal rotavirus. We talked about MMR, varicella. We also vaccinate against hepatitis A. And then HPV is recommended. And then the Tdap booster comes a little bit later.
All right, so we're starting with HPV as early as elementary school.
Is it 12?
HPV? Yeah.
HPV,
Yeah,
that's a
from 9 to
later
12.
one,
Yes.
right?
Yes.
Okay, that's. I didn't know hepatitis was on the list now. How long has that been a situation for vaccines? I mean, for children, I guess. Hep A, Hep B.
Hep B has been on there for newborns before they leave the hospital for probably a good 20 years now.
Okay.
At this point. They had been doing select groups before then, but then decided, let's broaden this. And the reason is we don't have a cure for hepatitis B. If you have it and you get the chronic complications, even though it's a small percentage of people, there's not much you can do about that. So the thought is, let's immunize widely against a disease we don't have any cure. For instance, in direct contrast to hepatitis C, we don't have an immunization, but fortunately we have medications that can effectively cure it.
I don't want to go too much of a rabbit trail, but what are the different Hep A, Hep B, Hep C? What are those distinctives there?
Hep A is probably the one that we think of. I think within the past 9 months, there was a restaurant locally that had issues with hepatitis A, and we were worried about transmission. The Department of Health was intimately involved in that and making sure they bring individuals up to speed, both adults and children, who might have had exposure. And that could be from produce or other food items, for instance. The net result is an infection for the liver. Hepatitis B, hepatitis C, we might think more of bloodborne transmission, sometimes sexually transmitted as well. And again, the net effect is inflammation, infection from the liver standpoint,
Right.
but from a different source.
I can't imagine that. I would imagine that it's a very serious condition to have this liver disease for a child, a 4-year-old, a 5-year-old, or what have you.
No doubt, and for any age, but especially so from a child standpoint, more likely to have some of these potential for long-term complications.
Yeah, as far as how you roll these out, are these done generally in clusters? Are they done? Do you stretch them out? Is that a family and doctor conversation? How's that work?
There's a recommended schedule that I would say the majority of people still follow, like doctors' offices, but I think there are more families now that have interest in maybe an alternative schedule. They would talk with their family doctor about what that might look like, but the CDC recommended schedule is based on a lot of research for efficacy, so that's why that schedule exists the way that it is.
Yeah, and they always used to say that the child is born with immunities that they receive from their mom, right? When does that wear off? I mean, how soon do we start? You're saying that some shots are happening before they leave the hospital,
Yeah,
right?
and there's certainly variability, but that lasts for weeks to months. Certainly being breastfed will help extend that as well. But yes, that goes away sooner rather than later. So anything we can do to start to prime that system is obviously we feel advantageous.
Sure. Let's take our break, and then we're going to talk about just some of the conversations that are happening right in there's a reason why we're having this conversation today, because there's a lot of information out there, good, bad, or indifferent. Let's talk through some of that here. It's 4:18. It's Talk Erie and the Joel Natale Show. Talk Erie and the Joel Natale Show. Erin Mrenak, Dr. Timothy Pelkowski are with us from the Erie County Department of Health. They're talking about back-to-school immunizations. And Erin, the last time you were here, it was kind of good for us, bad for the community, that literally the day you came, there was an outbreak of measles. How'd that all turn out? Because you ended up with a lot more cases than we originally thought. What were the conditions around all that stuff?
We ended up being very fortunate that Erie County still has pretty good rates for MMR vaccinations.
Okay.
And every family that we spoke with did a great job of following the protocols for quarantine to ensure that it didn't spread further. So really, though we did have some cases, it was very contained.
And were these all little guys that got sick, or not really?
The first two we had, which were separate from when we had the outbreak, were both adults, actually.
Oh, okay.
The second batch were all children.
Okay.
Yes.
Yeah. And what did we learn from that? Was it basically that we just people started avoiding the measles vaccine, or how would so many children, because it ended up being quite a bit of a cohort, didn't it?
Well, children aren't eligible for their first dose of MMR until they're 12 months old. So there is a risk for kids that even if their parents want to have them vaccinated, they're not eligible until later. So if you have measles exposure under 12 months old, you're at very high risk. It's one of the most contagious diseases that's out there. And we hadn't seen a case locally in over 30 years. So I think it was really surprising to people that we had cases, and we did a lot of outreach from the health department to medical providers, daycares, schools, to make sure people had the right information, really encouraging people to make sure that their vaccination records were up to date. We found specifically that a lot of people in my age group, before electronic medical records were a thing, if your mom hadn't saved your vaccine cards, you didn't have a way to tell if you were vaccinated. So most people were, 'cause it was just very common that you just got your shots then.
Right.
So we had people coming in because if you're not vaccinated with one dose of the two MMR vaccines, you have to quarantine with exposure for 21 days because it has a very long incubation period, and you're contagious with measles for two to 3 days before the rash breaks out. So before you knew it, you could be spreading it to other people. So it was a real learning moment.
It makes you wonder, people in their middle 50s and 60s, where that card is that you carried around, or probably could be sitting in your grade school folder, your permanent record.
Yes. So we had a lot of people coming through when we offered some free vaccine clinics that were adults coming through just to make sure if they didn't have a card that wanted to make sure, because it's not harmful to get an additional dose, so that they were protected.
All right. So basically, what do you think? Are we in a good place here on out that we're trying to cover with vaccines, or is there still some vaccine hesitancy when it comes to measles in this town, at least?
Our vaccination rates are very close to 95%, which is the recommended percentage to be considered have herd immunity. If it starts to dip below that, you do risk more of an outbreak situation, because the people that are vaccinated are protecting the little ones, especially that aren't eligible for the doses yet, and they're very susceptible to severe illness.
We have a lot of older folks. Does any of this stuff come into play? I've got COVID, shouting in my ears of okay, we have to protect the young ones and the older ones. When it comes to these normal childhood diseases, which basically have been eradicated, is there concern for older adults that maybe have waning immunity, I guess?
Especially with measles. If you've had measles or had your shots, you're very protected lifetime against measles. It's very effective. That virus does not mutate very quickly at all. So the vaccine we've been using for a long time is still really effective against disease. So and it's pretty much assumed that if you were born before a certain year that you probably had measles, and so you're considered immune. So we wouldn't necessarily have to get you vaccinated unless you chose to be.
Gotcha.
I can't help but mention just how important that herd immunity component is, right? Most elderly will do well, but those who are immunosuppressed, maybe because of cancer treatments, for instance, in particular, if we can maintain that herd immunity, we can make sure that we keep them out of trouble, if you will, with some of these illnesses. And I can't resist but mentioning how lucky we are to have a robust Department of Health here, right? And I think this hepatitis A outbreak, the measles outbreak, really showcases that in particular. And as we had been talking about earlier, many younger physicians have never even seen any of these diseases. We relied on the Department of Health to bring us up to speed, educate us on this, remind us of some of these illnesses that we have not seen in such a long period of time. So it's wonderful for us to have that resource. And physicians will reach out directly to the Department of Health, and it's great to be able to have access to that.
Yeah, it almost makes me wonder, that first doctor that saw this rash and saying, okay, what is this? Would it come up in a blood test? I mean, how did they make that first diagnosis, do you think, Doc? I mean,
usually clinical suspicion.
Okay.
Seeing the rash, seeing the history, that's what drives most of this. And then, of course, supplementing that with lab work to make certain that we're,
so that'll come up in a blood scan.
We can see that, yes. Yeah. And timing
I'm
is
just
a key
thinking of those
thing.
two adults, right?
Mm-hmm.
It's like, what do you got there? Do you have Lyme's disease? I mean, think about any number of rashes, right?
Yes.
Well, and measles is a respiratory disease, so it starts out looking like respiratory disease. So there's a cough, there can be a very high fever, often there's pink eye that comes along with it.
Geez.
So a lot of things would lead, that stuff happens before the rash breaks out too.
Let's talk about some of this vaccine hesitancy. We'll have to carry this over to the next segment. But again, there's the national stories, and then there's the reality here in Erie. You talked about, we have this robust health department, and part of your main mission is public information, public education, and so on. Do you think that we do better? We have that 95% immunity rate. Do we do better because of the efforts of the health department to just kind of like keep people informed?
I think having a local health department is always great, but it really is a community approach to making sure, like, we depend on schools and primary care physicians and community health centers to make sure that information's getting out there. So though we may prompt some of those conversations, those partnerships and collaborations are really important in keeping that message consistent.
Yeah. When a family is hesitant on a course of shots, what are the consequences at the school level? I mean, again, you got that kid. He's coming up. He or she coming up for kindergarten. Are there rules that would keep them out of school? What's
Yes.
the status?
This is a very busy time of year for us at the health department because we are getting ready for back to school, and kids have to have their immunizations before they can go on the first day. So we work really hard starting even as early as end of June, July, making sure that we've got appointments available. Now we can only vaccinate a certain cohort of people because of the rules that we have to follow at the health department.
What does that mean? I'm sorry.
So we can only vaccinate, because of our funding streams, people that are uninsured or underinsured. So we can vaccinate people with medical assistance, but we can't vaccinate people with private insurance. So we would make sure that they get to an appropriate place that can do that.
Gotcha.
Yeah.
Gotcha. That's good to know. And so if they're like, what's that workflow? Is as a family self-reporting, hey, my kid doesn't have his shots. Are they telling that to the principal at the school, or are they finding out for the principal at the school that as part of a questionnaire or part of orientation, do you have all your shots? Oh, no, we don't. Like, what's that workflow?
Usually during the registration process for kindergarten, you have to submit a packet of information. One of them is those records. And then if the school will advise you what you need to have if you're missing anything, and then usually we'll get a phone call and we'll help. If we can't do it, we get them to the right place that can do it. And now there are certain exemptions that can be made that schools abide by. So there's medical exemptions, there's philosophical exemptions that may be on the rise a little bit. But it's, like I said, our vaccination rate is still for kindergarten. They track it in 7th grade and 12th. It's pretty good.
We're going to take our break here. We're talking about back to school immunizations on this Health Focus Wednesday. Thanks so much for tuning in. It's Talk Erie and the Joel and Natalie Show, live from our Kingdom Financial Group studio here at 5th and State. And joining us today, we're talking about childhood immunizations and getting the kids ready for back to school. We have Erin Mrenak. She's the Director of Public Health for the Erie County Department of Health and the Chairman of the Board of Public Health, Dr. Timothy Pelkowski. You just have to go to the boardroom if you're going to be the chairman of the board, right? Listen to Sinatra. Wasn't he the chairman? Anyway, let's keep on this in talking about mitigating issues with immunizations and that hesitancy that sometimes comes about. Just when you're sitting across from a mom and dad, a caregiver, or so on. What do you tell them about? I mean, because if you just talk about efficacies and things, it doesn't sink in as more of a heart-to-heart talk, right?
Yeah, I think we always try to have a non-judgmental approach and really approach people with kindness and empathy. And we want to listen to what they have to say, and where we have a chance to interject with information that may make them think differently about it, we absolutely do that. There are some people that we're never going to change their mind, but there are a lot of people that just have concerns, and having a listening ear or a caring physician or a nurse that can speak with them about it really allays a lot of fears, and we find that people are very receptive to a conversation. Is
socioeconomic impacts or being a new American, cultural differences? I would imagine, if we were to go back 100 years ago, I'm sure that my grandparents were wondering, what are we doing here? I would imagine that happens now with some of our new Americans and so on, because these are not universal. Maybe they're not. Maybe these shots are not available in a Sudan or a Somalia or Afghanistan.
A lot of the vaccinations are done before people come to this country. But if they're not, we actually work with a lot of new Americans coming in to get them, adults and children, to get them up to date with their vaccinations. And people in general are very receptive to getting that.
On the other side, Doctor, do you see that those really hyper-informed parents, do they sometimes need some help in understanding why this is so important?
I would agree. It's interesting. I feel like some of the statistics and data around this show that there may be more questions from our affluent patients, for instance, than say our underserved, which is intriguing. And I would echo what Erin said. We're trying to meet them where they're at. We're trying to go through education. We're going to be there for them no matter what their decision is, whether it's holding off on all vaccines or selectively holding off. But really trying to focus on that education, again, respectful, lack of judgment, acknowledging that these are valid concerns and we should discuss them.
I don't want to get political at all, but obviously the director of HHS, Robert Kennedy, is a very loud voice in all of this. Is that making your jobs harder?
I would say at the health department, we haven't really seen an impact of that. Okay. I mean, there's a lot of messaging out there. There's a lot on social media about it. But as of right now, nothing has changed with the childhood immunization schedule. Flu vaccines are still going to be available. We're waiting for the most current version of a COVID-19 booster to come out, which is scheduled to come out hopefully mid-September. So right now, we're kind of operating business as usual. And if we have always gotten questions or concerns about vaccines, so it's something that we're very used to dealing with. And
I was going to say, 30 years ago, you had celebrities, right? I mean, Jim Carrey and whoever.
So we have nurses that are very trained in handling those questions, and physicians are really good at doing that as well.
Yeah, it's it's an interesting place where we are, because we are fighting a lot more. It seems like the list has gotten larger, right? And when is it okay or better to actually get sick and go through it?
I mean, for a lot of these illnesses, people died from them. They're very severe, had very long-lasting health effects, and that's what drove vaccinations to be created. So there may be times where you feel like it's better to just have the measles, but I think people always don't also realize how miserable it is having measles. And it's not just like your acute infection, there can be long-lasting health consequences for the rest of your life that happen. So it is in most cases, safer to get a vaccine to build that immunity than it is to get the actual disease itself.
Yeah. The and Doc, there is that whole reporting for any side effects of vaccines, right? Isn't there a whole reporting system?
Absolutely. There's a national federal program in particular, making sure we get this feedback to the makers of these immunizations. So if there is an issue, we can address this, take a look at that. So do try to make sure that that's very robust from that standpoint. Nothing in life is perfect. I'm not going to say that. But making sure we stay vigilant, maintaining a studying of these kinds of agents is important.
So you think about it. It's families, it's parents, it's children, it's the school, it's the health department, it's the family physician. There's a lot of players in all of this that kind of keep the kids safe, you know.
Well, we're very fortunate in our country that we have all of these resources. In many parts of the world, a lot of these things are still very active, and kids get very sick from it, and kids die from these diseases because they don't have access to medications or vaccinations.
Let's talk about the financial part of this. You mentioned that y'all at the health department can serve on those without insurance or something like that. Are insurances required to cover at a certain level? I mean, commercial insurance, Highmark, Aetna, whatever, UPMC. What is this? Like if somebody goes to their family physician to get these shots, what gives? Like what's a copay generally?
Yeah, in general, these are all in fact covered. They may have to be given at a pharmacy versus a physician's office.
Okay.
Just given some of the politics associated with insurance. However, still available. And I think making sure we have resources in our community. It's not surprising that we have so many different avenues to keep our children healthy. Thank goodness we do from that standpoint. But in general, all covered. I think that's where some of the concerns really weigh in, where some of these political changes, the fear is, will that change insurance coverage? Will that impair some individuals' ability to have that? We're hoping that those kinds of things don't occur, but I think that's what the fear is from the medical community. We want to make sure that everyone can receive these immunizations and not have to worry about payment, even if it's just a co-payment. Quite frankly, we want no barriers related to that. Yeah,
you want it wide open. In regards to, you mentioned flu shots and COVID shots, and we were under a whole different protocol during the actual pandemic, where the feds were paying for everything. Is that similar though for if you want to get a COVID booster or when you get your flu shot? What are the financial parts of all that?
Flu shots, nothing really has changed in terms of coverage for that. There may be some differences with recommendations for the most current COVID booster that's going to be coming out. They're definitely recommending it for 65 and older, and then from 12 to 64 with certain health conditions, basically any condition that will have longer lasting effects if you get COVID. So obesity, diabetes, a lot of those types of chronic health diseases. But we haven't received the final guidance yet before the new formulation comes out yet.
What about testing too? Do people still test?
We still get calls frequently for rapid tests, and we still have a supply at the health department that we'll give to people if we get a phone call about it. It's still like hospitals do it. It's standard panel now. If you come in with a respiratory disease, they're testing for flu A, flu B, RSV, and COVID.
Yeah. I wanted to ask you, because those are the typical seasonal respiratory diseases. Are there shots against like an RSV or something like that?
Yes, there are shots against RSV, and we're still monitoring RSV, flu, and COVID in the wastewater as kind of a predictive tool for when those illnesses are hitting our community. So we have a dashboard up on our website that shows all of those things. We're tracking COVID variants. So that's one of public health tool that we use to kind of survey what's going on.
And so important
That's
for
our
us.
tip to hat to Dr. Nadwarny, right? From AHN.
No doubt.
And we're testing for measles now, too.
Are we
that
really?
We'll
Wow.
know if we have measles in the wastewater before we even have cases, so we can get education out to healthcare providers.
What were you
That'll
gonna say,
help-
Dr. Sarah?
Exactly that point. That will help clue us in to let us know, hey, keep your index of suspicion high. This is out there. We need to watch for it and be prepared. So yes, these kinds of monitoring programs are wonderful from the practicing physician standpoint.
Okay, here we are 5 years from the summer of COVID, right? 2020, right? When we were yelling and screaming at the governor to get us back into the green. Remember, we were in the green, and we went to we were the last. We went green with Philadelphia, which was really interesting. Anyway, all that water is under the bridge. But my question is, do we have our foot, have we taken off our seatbelt when it comes to COVID? And I mean in things like PPE, and in just being vigilant about stuff, because that's the typical cycle is that it's in the rearview mirror. We forget about it. So, our stocks of masks, our stocks of all the apparatus, they go south and so on. How do you stay vigilant on a public health footing?
So we have actually specific positions just for public health preparedness, that they work on plans. We do tabletop exercises that involve sometimes community partners, so that if we do have a disease outbreak, we know how we're going to respond, and we practice what that would look like as a way to just maintain our awareness, so that people are educated on some diseases that we may not have seen in a while, so that people have the education. And then we want to know, like, okay, what might we need to send out to the healthcare systems? How can we make sure that we're all on the same page in terms of identifying and then reacting to that? Because it's going to happen again. We're not going to be in a place where we don't have a disease that's on the horizon. Right. So being mindful of what we learned during COVID and not forgetting, there were lessons learned, good and bad, from that. There's things we did great, and there's things that we could have done better. So just processing all of that and making sure we're prepared for the next thing that comes. Do
you think that there's a investment that communities should be making? I'm just thinking about, they always want us to wash our hands or, to sanitize and whatever. And here we are, downtown Erie. There's still not a public restroom, for example. I'm just wondering about, when you talk about the bigger, look at the bigger issues of public health, what are things that, that our elected should be thinking about, or, that our activists should be thinking about when it comes to this kind of thing?
I think
5 years in the, with COVID.
Being very mindful of that public health needs consistent funding when you're not in a disease state. We got flooded with dollars during COVID that they were very specific to COVID. And then what happens is, once people aren't like, oh my gosh, we have COVID, then the money dries up. Yeah. And all the stuff that we were able to build and infrastructure we were able to put in, or positions we were able to create, this is happening across the country. It's a struggle to keep that, because then you're looking at state and local investment in your public health departments to do that. So having funding that's consistent to support that infrastructure, so that we can do surveillance and be prepared and do activities, that's really important. So advocacy for those types of dollars is really crucial to how public health operates.
Have they kept up, like, with the dashboards, at, let's say, the State Department of Health or CDC or something, where they're really able to pinpoint the data points?
I know a lot of things changed with public health data during COVID. We were woefully underprepared for the amount of information that we were dealing with and trying to analyze and put out in a way that the public could digest it, so that people knew people were scared, and we were trying to get information out to folks. So we've done a lot of work locally at the health department to make sure that we have better surveillance tools, and we've invested in some new technology that allows us to build dashboards that we can adapt to most diseases. Like, we just put up a West Nile virus dashboard because we've had some positive mosquito pools, so that we can get information out that's easier to understand for folks and visualize.
We haven't had a human case now in a few years, right?
Correct.
What? So they were finding it in the mosquitoes. It's just nobody's gotten bit by one, I guess.
Or it hasn't been enough where they're testing, like at a doctor where they're testing positive for something. Mm-hmm.
And docs usually they would be able to identify, let's say, a bite, or what would be?
Again, be looking for specific symptoms and really relying on this monitoring. Is it spiking in this community, where we need to really think about this and be hypervigilant, if you will? Very helpful, because it can be hard to pinpoint a case just out of the blue.
Yeah. I'm glad that we haven't seen it, even though we've seen again a lot of positive mosquitoes. I've just got a couple minutes, and I want to make sure that we cover everything. Again, especially for those young parents, it's their first child going into kindergarten. this is not supposed to be onerous, but it is comprehensive, isn't it?
It is.
As far as these immunizations, right?
Yes, there's a schedule. There are a lot of them, but they're there for a reason, because kids were getting really sick in the past, and that's what spurred the development of these vaccines, which are tested exhaustively before things are approved, and then they're monitored very highly even after it's been approved to make sure that there's not long-term consequences or something happened that didn't come up during research. So all of those things are still happening.
Yeah. Doc, any final words there?
Just really going to mention or parrot back what Erin had said. It is important to maintain our robust Department of Health. We don't know what's going to be on the horizon, but there will be something on the horizon.
Yeah.
And I think it's really important to make sure that we maintain this robustly for the health of our entire community, regardless of your age. So yeah, I'm going to end on that note. I think that's really vitally important for anyone involved in advocacy, legislatures, to think about this and make sure that we don't let this fall off and then be caught with our pants down, if you will, the next event.
Right. Well, it occurs to me that AI is probably going to be a friend of public health.
Yeah, I think it has a lot of potential for helping analyze data very quickly. So there's a lot of chatter kind of in the public health community about what that looks like, how to use it ethically. It's not a replacement, but it's a tool for us to use, and what's the most ethical way for us to do that. We deal with a lot of personal health information. So how do you use AI in a way that's not like violating confidential? Like, what does that look like? So there's a lot of talk and training and education happening right now around AI and public health.
Yeah, you think about contact tracing. If you had a tool to just go faster.
Yeah.
I don't,
So we built one at our health department.
Did you?
Using like GIS information that will allow us via email to contact people that it'll be a symptom checker. So before it would be all text messages or phone calls by people. So we can automate some of it now. We'll still reaching out to our high risk folks or people that might have the illness to check in every day. But we were able to develop that during the measles outbreak. So if we had any new cases, which thankfully we haven't, we were able to roll that out if we need to.
Wow.
Yeah.
Wow. Again, public health, it's important. We didn't even get to any of the, the public health 2.0, 3.0, the social determinants of health. But getting your shots for healthy kids as they go back to school, smart thing to do. I appreciate it very much. Erin Mrenak, Director of Public Health, Dr. Timothy Pelkowski, the Chairman of the Board of Health from the Erie County Department of Health. Thank you, folks, pretty much.
Thank you very
Thank
much.
you so much.
You got it. Here it is, 4:52.